Hey everyone, welcome back to my ACL Science Breakdown series where we unpack the latest research so you can rehab smarter, get stronger, and return to sports with confidence. I'm Alan and today we're tackling a hot topic, blood flow restriction training. Does it actually help after surgery? BFR is everywhere in the rehab world, but a recent 2025 randomized trial and a new systematic review are raising some big questions. Let's break it down together. First, a quick primer. Blood flow restriction training involves using a cuff or a band to partially restrict blood flow during low load resistance training. The idea is you train at 20 to 30% of your 1 rep max, but you still get strength and hypertrophy, similar gains as if you would with heavier lifting. And this is all thanks to the increased metabolic stress and muscle fiber recruitment. Sounds great, right? Especially in the early stages of ACL rehabilitation when you can't really load it heavy, but you still need to wake up that quad. And that's the reason why blood flow restriction training has become so popular in ACL rehab, particularly from weeks 2 to week 12. But what does the science say about this? In February 2025, Erickson and his colleagues published a randomized trial. They looked at 48 athletes post-ACL reconstruction. Half of them did standard rehab and the other half used blood flow restriction training in the early phases of their rehab, and both groups were followed 4 to 5 months. The key outcomes: quadriceps strength, muscle cross-sectional area, and functional outcomes. And here is the surprising part. There was no significant difference between the blood flow restriction training group and the control groups at the end of the program in terms of muscle size or strength. So both groups improved well, but blood flow restriction training didn't really offer an edge, and that's a big deal. Then another 2025 paper looked at blood flow restriction training across several studies in ACL rehab, and it was the same story. While some patients saw modest gains mid-term function, there was no consistent advantage in early strength or hypertrophy compared to standard rehab. Plus, the studies varied a lot in terms of cuff pressure, exercise type, frequency, and when blood flow restriction training started in their program. All of this making it hard to draw clear conclusions. The bottom line here is that blood flow restriction training might not be the magic bullet we all hoped for during ACL rehab. This matters because blood flow restriction training isn't just an exercise. It requires specialized equipment, training for safe application, monitoring for discomfort, numbness, or excessive pressure, and sometimes extra cost for patients. So if the results aren't clearly superior, we have to ask ourselves, is it worth the complexity and cost? The current evidence suggests it might be a nice to have tool, but not essential for most ACL patients. Now, don't throw off the cuffs yet. There are scenarios where blood flow restriction training still could help. When you have severe quad inhibition early on, limited access to gym equipment, weight-bearing restrictions after meniscus or ACL, and patient psychology. Some patients just feel more engaged when using blood flow restriction training. Also, long-term studies are still limited. Maybe blood flow restriction training offers value in later rehab stages or with patients that struggle to regain quad mass. So instead of being the go-to for everyone, blood flow restriction might be best used selectively, based on patients' needs, goals, and available resources. Let's sum it up. Blood flow restriction training is safe and helpful, but it's not essential for every ACL rehab patient. The latest studies show no clear advantage in terms of strength or muscle size at 4 to 5 months. Use it selectively, especially for those with poor quad activations or limited load capacity. Now, my question to you is, have you ever used blood flow restriction training during your ACL rehab or just in general in your training? Did you notice faster gains or was it just another tool? Drop a comment below. I want to hear your take. Don't forget to subscribe, like this video, and share it if you want more ACL rehab science breakdown series, so we make sure you rehab with science, not guesswork. Thanks for watching this episode, and I will see you guys next time.